Think you know your personality type? Think again. From narcissists who crave admiration to paranoids who side-eye everyone around them, everyone is wired differently. Are you borderline or just OCD? Ever wondered what separates schizoid from schizophrenia? You're about to find out. On today's episode of The Infographic Show, we're explaining every personality disorder. Number 10. Paranoid personality disorder, or PPD, is characterized by a constant distrust of other people, regardless of if there is any reason to distrust them, hence paranoid. People with PPD are suspicious of everyone around them. They are withdrawn, easily insulted, and hypervigilant of potential threats everywhere they go. They also struggle to form meaningful connections, driven by constant paranoia. Emotionally guarded and suspicious, they often read malicious intent into even the most innocent interactions. These people also hold grudges like nobody's business, and they have a strong sense of personal justice. This disorder often appears alongside a number of other personality disorders. Some studies suggest that PPD might have a genetic link to schizophrenia, but the conditions are still largely considered distinct, since sufferers of PPD don't experience delusions or hallucinations, beyond reading dark intent into everything everyone else is doing. A Norwegian study found PPD to be somewhat hereditary. Paranoid parents often pass their distrust to their children, who may develop the same patterns as they grow older. PPD affects between 0.5 to 4.5% of people, and while men have higher rates in clinical samples, overall the rates are higher in women. People with PPD rarely seek treatment on their own, but the disorder can be managed with a mix of psychotherapy and, in some cases, anti-anxiety medication. Number 9. Schizoid personality disorder, or SZPD, is different from schizotypal personality disorder, more on that soon, and schizophrenia. The schizo in all three comes from a Greek word meaning split, referring to how people with schizoid personality disorder are emotionally split off from the world around them. It's characterized by a complete and utter disinterest in other people. They tend to be unexpressive and apathetic, with no strong feelings on politics and no interest in sex, romance, or friendship. Kind of like your coworkers in that sense. People with SZPD prefer to do everything alone. They have no positive reactions to being praised and are often fantasists with rich and elaborate inner worlds. The disorder is believed to be caused by a number of factors early in life, including neglectful or overcritical parents, traumatic brain injury, and prenatal malnutrition. Schizoid personality disorder is extremely poorly understood since it's so often difficult to distinguish from other mental conditions like PTSD or autism spectrum disorder. It's unclear how common schizoid personality disorder truly is, and some experts have even argued it should be removed from the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, entirely. Estimates suggest it may affect up to 7% of the general population, and as many as 14% among unhoused people. Number 8. Schizotypal personality disorder. People with schizotypal personality disorder have difficulty recognizing emotions and social cues, as well as difficulty controlling their facial expressions. They often suffer from delusions, and they're likely to be extremely superstitious or believe strongly in paranormal phenomena. They might also speak or dress in an unusual fashion and frequently talk to themselves. This disorder's classification is actually pretty controversial. The DSM-5 lists it as a Group A personality disorder, associated with eccentric behaviors. Meanwhile, the latest International Classification of Diseases classifies it as a psychotic disorder related to schizophrenia. This overlap makes things complicated. Schizotypal personality disorder is often comorbid with schizophrenia, and the personality disorder diagnosis frequently comes first. The key difference lies in the severity and the consistency of symptoms. It's also commonly seen alongside ADHD, autism, bipolar disorder, PTSD, dissociative identity disorder, and other personality disorders. Schizotypal personality disorder is more commonly diagnosed in men than in women, and it's thought to be overdiagnosed in Russia and other post-Soviet countries. Most people who end up in treatment for schizotypal personality disorder are initially seeking treatment for anxiety or depression. The next set of disorders fall under Group B, the dramatic types. What connects these 4 disorders is a pattern of unpredictable behavior, unstable relationships, and intense, often overly emotional thinking. Number 7. Borderline personality disorder, or BPD, is characterized by extreme fear of abandonment, an unstable sense of self, and a tendency toward black and white thought patterns. People with BPD have big, dramatic mood swings, are very impulsive, and are likely to develop addictions, gambling problems, eating disorders, and self-harm behaviors. People with BPD have a strong desire to be social and experience extreme distress at the idea of being left out or abandoned by the people around them. Despite that desire to be social, they have difficulties maintaining relationships due to a habit called splitting, where they view everyone in their life as entirely good or entirely bad. When they perceive someone as good, they'll want to be around them all the time, only to cut that person out of their life completely once they do something bad. BPD is one of the more well-understood personality disorders, and it's also one of the most stigmatized. Due to their extreme emotions, there's a common misconception that people with BPD are violent and manipulative. But in fact, the opposite is true. People with BPD are more likely to be the victims of familial or intimate partner violence than the perpetrators, as their fear of abandonment can trap them in toxic relationships. Number 6. Histrionic personality disorder, or HPD, is characterized by an inability to measure self-worth without external attention. People with HPD have a pathological need to be noticed and validated by others. They'll often do outrageous or even dangerous things to get attention. They typically have good social skills, but will act out if they feel they aren't getting enough attention, and react badly to perceived criticism or failure. They often dress flamboyantly, have extreme body modifications, and often behave in a sexually provocative manner, even when it isn't appropriate. People with HPD are prone to eating disorders, substance abuse, and harmful ideations. It's believed to be caused by a number of factors, including neglectful parents, hormone imbalances during puberty, or the death of a loved one during childhood. The disorder is comorbid with other personality disorders, as well as depression and anxiety. About 65% of HPD diagnoses are female, with some critics in the field claiming it's overdiagnosed in women due to many of the traits like vanity, jealousy in relationships, and a fixation on social status overlapping with sexist stereotypes about female behavior. Number 5. Narcissistic personality disorder, or NPD, is probably the most commonly misunderstood disorder on this list. It's a disorder characterized by being self-obsessed to the detriment of one's relationships with others. People with NPD have an inflated sense of their own importance and require a lot of external validation to maintain their self-esteem. There are two main types of NPD: grandiose type or vulnerable type. People with grandiose NPD are obsessed with themselves in a positive way. They are arrogant and seek to be dominant in all social interactions, often leading them to belittle others. Meanwhile, vulnerable NPD manifests in a negative self-obsession. People with this type are extremely self-critical. As a result, they feel inferior to others and are extremely sensitive to criticism. In either type, people with NPD are prone to depressive episodes when they don't meet their own standard of perfection, avoidant of any situation where they might fail, and they have difficulty adapting to changes in their life. A common misconception is that having NPD makes you evil. If you have ever heard the word narcissist used, it was probably by someone talking about their abusive boss or their ex-partner. In reality, just like with any personality disorder, people with NPD can change their negative behaviors with psychotherapy. And in case we have to say this, no, narcissists are not possessed by Jezebel spirits, because demons aren't real. And if you're thinking about the phrase dark empath right now, you need to spend less time on TikTok. Number 4. Antisocial personality disorder, or ASPD, is another extremely misunderstood condition, especially under the old name of the condition, sociopathy. ASPD is a condition marked by a lack of regard for right and wrong, as well as a disinterest in the well-being of others. People with this disorder are emotionally cold and chronically bored, and they often act impulsively just to see what happens. In extreme cases, this can include hurting other people, either emotionally or physically. Some people with the disorder struggle to read social cues or understand what those around them are thinking. Meanwhile, others can interpret behavior perfectly, but still can't connect emotionally. This leads to manipulative behaviors, as someone with ASPD might lie to get whatever they want, understand why lying is wrong, but not understand the impact of their behavior on an emotional level. Like the other Group B disorders, people with ASPD are prone to addiction and self-harm. ASPD occurs in about 1 to 4% of people. It's diagnosed at a higher rate in men than it is in women, which is unique among the Group B disorders. It's notable for being extremely overrepresented in prison populations. Also, unlike other personality disorders, there is some evidence to suggest that you eventually grow out of it. Symptoms tend to reduce in severity from age 40 onward. And now we get to Group C, the chronic worriers. People with the 3 disorders in this group have a pattern of dysfunctional, maladaptive, anxious thinking and behavior. Number 3. Avoidant personality disorder, or AVPD, is characterized by low self-esteem and difficulty in social situations. People with AVPD have an intense fear of being rejected or humiliated, and they generally have a belief that they are somehow inferior to other people. They deal with their fear of rejection by preemptively self-isolating and avoiding all social activities. This leads to them having intimacy issues and a tendency to abandon relationships out of fear that the other person doesn't like them or is planning on rejecting them. People who were neglected by their parents or didn't have many friends as children are very likely to develop AVPD, but it's possible for the disorder to occur without a history of abuse as well. AVPD was once considered a severe form of social anxiety, but researchers later found many cases didn't meet the criteria for that disorder, leading to its classification as a separate condition. The key difference is that anxiety isn't the driving force behind AVPD. Instead, people with the disorder tend to act the way they do because of deep-seated low self-esteem, not fear. AVPD is present in about 1.5% to 2.5% of the population in the USA, and it affects both men and women equally. Number 2. Next is dependent personality disorder, or DPD, which is characterized by an extreme dependence on others and difficulty making decisions for oneself. People with DPD are submissive, clingy, and they tend to prioritize the needs of others over their own needs. They lack self-confidence and self-esteem, believing that other people are smarter and more capable than they are, and they're often very sensitive to rejection. They also experience cognitive impairment caused by their lack of confidence making decisions and forming opinions. People with DPD have a hard time being left alone and will become distressed when separated from their support system. People with DPD get very attached to others very quickly, and their fear of being alone can lead to them staying in toxic relationships. This disorder is common in people who had overprotective or overly strict parents, or who suffered serious illness in their childhood. It may also develop as a result of growing up in a religion or culture that prioritizes submission to authority. It's believed that these cultural factors are part of why it is more commonly diagnosed in women than in men. DPD, like most personality disorders, is best treated through psychotherapy and cognitive behavioral therapy. Number 1. Obsessive-compulsive personality disorder, or OCPD, is not the same as obsessive-compulsive disorder, or OCD, though the two can occur together. Some experts question whether they are truly distinct or simply points on the same spectrum. Both share traits like rigidity, ritualistic behavior, and an obsession with order, lists, and schedules. But one key difference is awareness. People with OCD usually recognize their behavior as irrational, while those with OCPD often see their habits as completely justified. People with OCPD have an obsession with detail that can lead to them appearing very successful from the outside. However, on the inside, they suffer from intense anxiety brought about by their perfectionism. They're workaholics who will fixate on a project until it's done to an extremely high standard. They find it difficult to compromise, and they can't cope well with change, sometimes to the point that they refuse to throw broken items away. They have an excess of caution and a struggle to make decisions out of a fear of failure. OCPD is the most common personality disorder in the USA, affecting about 3 to 8% of people, and affects women and men equally. You've seen how personality disorders work, but what about one of the most misunderstood mental illnesses of all? Watch Do These Bipolar Disorder Symptoms Sound Familiar to see how it really feels to live with it, or click on this video instead.